So if everybody would please lie on your backs. And just start by noticing your breathing, feeling how you're resting on the floor. So in these lessons we take a lot of pauses to just notice the relationship of how our body is resting on the floor. How are we letting the floor support us right now? And I'll throw this out. There's a couple of younger people in the room. When I discovered this work in my mid-20s, I used to think, wow, if I had known about this when I was in high school. So we talk about all these relaxing, gentle movement kinds of things, but it also can be significantly helpful in progressing movement for athletics and exercise. And just get a sense of the length of your spine from the base of your head all the way down to your pelvis and the various curves in your spine. And if you could just mentally imagine the length from the base of your head to where your spine meets your sacrum. And then let your arms rest on the floor and take a mental note of the length of each arm from the tip of the shoulder to the tip of your longest finger. For some people it's your middle finger. For most of us I think it is. Aren't there some people who have like a longer ring finger? Anyway, so get a mental note of the length of each arm and just kind of compare. Does each arm actually feel like it's the exact same length? Often you'll have the experience that one arm's a little longer or shorter. You might notice as you're lying here that one arm's a little closer or farther away from your body, and you don't need to change that. I'll just constantly be bringing in possible suggestions of what you might be feeling to begin to train your brain to feel into yourself differently. And then notice the length of each of your legs from the hip all the way down to the heel. So there's 5 lines in your body that you can attend to. The line of the spine, each of your arms, and each of your legs. And just notice how your attention shifts from one to the other to the other. Can you feel both the lines of your arms in your attention at one time, or do you shift back and forth? Can you sense each of the lines of your legs together or separately? And if you were to imagine the length of one of your legs and compare it to the length of your arm or the length of your spine, and then through these lessons, know that if it's more comfortable for you to keep your knees bent, then please do so. For some people, having your legs long can really be a strain on the low back. So at any point, we want to really minimize the distraction of discomfort. I call it like static to the nervous system. So if it's more comfortable, bend your knees or keep them long. And just rest both of your arms on the front of yourself, somewhere on your trunk. And just feel each hand separately, so not hand on hand, but just let your hands sort of softly feel into wherever you laid them to rest. So soft hands And just feel the contact with your shirt or blouse. See if you can just sort of sense the skin beneath that. And you can even just lightly sense into the tissues beneath the skin. For some of you, your hands are up higher and you might sense into your ribs. For others of you, you might just feel your abdomen softly raising and lowering with your breath. Good, and then float both your arms, just kind of float them up above your trunk. And you're going to keep your elbows softly bent, and you're going to take one arm, you choose which one, and you're going to take your forearm and rub it on your other forearm. So you're just going to softly let your forearm, so you're going to keep your hands soft and sort of out of the picture. And if you chose your right forearm, it's as though your right forearm is exploring, touching all up and down your left forearm. And just notice, feeling, what do you have to do in your shoulders? Do you tend to go sort of crossways like a violin, or do you go long ways up and down your arm? How does that first forearm explore the other forearm? And then switch. Let the other forearm do its exploring. Good. And at any point, if your shoulders get a little tired, just kind of pause for a moment and then come back to it. And then begin letting both forearms explore each other. It's kind of like how surgeons wash their hands. You know, their hands are clean and they're scrubbing all the way up to their elbows, and they're making sure they're getting soap up and down. So let each forearm both be exploring at the same time. Hands soft, breathing full. And then just rest your arms down to your sides. And just see how your arms are resting. And then if they're not already, please bend your knees so you're standing through your feet. And just find a nice, stable place for your feet so that it doesn't feel like your knees want to tilt in or tilt out, but their knees are just nice and stable, sort of resting over your feet. And then just let your knees tilt a little bit left and right, and start with a very small movement. Just taking your knees softly left and right. And each time you go, you might let it grow a little bit, but only go as far left and right. So both the knees are going together in the same direction to the left, and both knees are going to the right. And go only as far as you can go where you can easily and effortlessly bring your knees back to upright. So we're not trying to do a big low back stretch or anything, just a rocking. Feel how your pelvis rocks from side to side, the back side of your pelvis. And for some of you, you might even be able to sense and feel that movement translating up into your spine a little bit. So there's a rotation in your pelvis. You might feel it go up into your spine and your ribs. And let your head go. Let your head follow your knees. So if your knees go to the left, just let your whole spine be soft. Nice and slow. Just feeling how the weight shifts on the back of yourself across your pad. Great. And then pause with your knees in the middle. And you can let your legs down long or keep them bent. So interesting thing about Feldenkrais is we take these pauses, lots of pauses. And obviously it's not because you're short of breath or overstretched. But remember, we're developing a new way of your brain relating to your body. So these are really mini brain breaks, because it's unusual to begin exploring movement and sensing yourself in this way, and your brain is especially for your first lesson, really kind of thinking, what is going on? So we give it a break every once in a while so it can assimilate new information. Okay, now interlace your fingers over your chest, please, and just sense that comfortable interlacing. And we call that habitual interlacing. So just unlace your hands and relace your hands, just 1 or 2 or 3 times. Just sense how you just fall right into that, how you lace your fingers. And then next time you undo your fingers, move it 1 finger over. And that's non-habitual interlacing. And just rest there for a minute and sense there's kind of an unfamiliarity, might feel unusual. If you're really sensitive, you might just kind of feel your brain wake up a little bit. And then shift back to the familiar, to the habitual interlacing. Feel that. Feel how it settles in like your favorite old tennis shoes that you know you shouldn't wear because they're worn out, but you love them anyway. And then shift to the non-habitual. And just do that a few more times, keeping the fingers really soft, making sure you're breathing. Notice the rest of your arm and your elbow, your shoulders and your wrists. What else is moving? Good. And then just let that go. You can keep your hands resting on your trunk if that's comfortable softly, or let them rest at your sides. And then again, please bend up both your knees, putting your feet on the floor. Now we're going to do a movement that is common in a lot of different Feldenkrais lessons. I want you to gently push through your left foot, keeping your knee relatively pointing towards the ceiling and lifting the left side of your pelvis just a little. It doesn't have to be a big movement. Pushing, pressing through the left foot, lifting just the left side of your pelvis. So basically, and then lowering back down and doing that several times. So basically your pelvis is rolling a little bit towards the right. Press through the left foot, gently feel that whole left leg connect into the socket in the pelvis. And really the weight should increase under the right side of your pelvis because you're going to roll the left side up onto the right side of the pelvis. Good. And then as you do this, let your right knee begin to drop out to the side a little bit. So feel the timing of pressing through your left foot, the left side of your pelvis lifts a little bit, the right knee drops out to the side, but the left knee stays relatively towards the ceiling. And then you lower everything back down and bring the right knee back up. Just feel that weight shift. And notice how it shifts not just behind your pelvis, but feel it shifting behind your back, up into your shoulder. And you might feel the weight shifting towards the right shoulder blade also. Notice if you're still breathing. And then just pause for a moment. And then begin the exploration through the right foot, but start small. Don't get all the way there the first time. Start with just connecting the right foot, the pressure, sensing into the floor, and then begin to feel that that invitation for the right side of the pelvis to lift so that your pelvis begins to tilt a little bit towards the left. And just gradually let that movement grow until you also sort of feel the invitation for your left knee to just drop out to the side. Might help you roll a little more. And just sensing all the parts of this movement. It's happening through your leg, connecting to your pelvis, feeling the movement translate up your spine, into your ribs, across to your left shoulder blade. And you might even feel your head wanting to roll a little bit too. See if you can let your neck be soft and your head can roll. And then let that all go. Let both your legs down, if that's comfortable for you. And just take a full rest. And while you're resting, you can just tune into those 5 lines and just sense, how are they doing now? Is there any changes that you're noticing in the line between the base of your head and your pelvis? Right arm, the left arm, the right leg and the left leg. There's this thing called gravity, and it's constantly inviting you to just let go and be supported by the floor, or your bed, or your mat. But often, we've spent so much time holding ourselves up to the day or to the people or against the pain or against the struggle, whatever it is, that it's hard to really let go when we're lying down. And often through these lessons, the first most obvious thing people begin to sense is just a relaxation. And that's lovely. But then the next step is to have more organization, more fluency, more effortless movement in your everyday life, more ability to just use your body to be more joyfully present. So please bend your knees up again. And let your hands rest on your abdomen softly. Just sensing into that. And with your right hand, gently begin to explore up through the center of your chest. So just bringing your fingers pointing towards your chin and just exploring your sternum. Just the sternum, and then back down to rest. And use as much as you can of your whole fingers, your whole hand, if that's comfortable for you, as though you're sort of feeling the sternum and maybe a little bit where the ribs attach into the sternum. You might feel those little bumps. And as you come up to the chest, begin to, with your right hand, explore a little bit towards your left shoulder, coming back down to rest each time. And also noticing as you explore the center of your chest and over towards your left shoulder, what's happening in your right elbow, your right shoulder, right side of your ribs and neck. And after you explore towards your left shoulder, you can begin going up towards the left side of your neck, the left side of your face and head. So just using that hand to explore that whole left side from your shoulder up to your neck and head, and coming back down. And each time you come up from your abdomen, see if you can discover something new, a new sensation, something you didn't quite notice about yourself before. I mean, often we all know what we look like in the mirror, but we really don't know what we feel like. You know, sometimes we plop ourselves on the massage therapist table, or the acupuncturist, or the physical therapist, or the chiropractor, but we don't usually take the time to really sense our own selves and care for our own selves in these ways. And then rest the right hand. And just as your right hand rests on your abdomen, just see if you can feel sort of the lingering sensations in your sternum and in the left side of your shoulder and face from having been touched. Does the left side of your face feel any different than the right side as you sense it lying here? And then begin the exploration with your left hand. So just starting low, low on the sternum, just really checking that out first, coming up and down. Eventually crossing over towards the right side of the ribs, towards the right shoulder. Feeling what's happening in your left elbow, your left shoulder. How does your left arm and shoulder help you get over to your right shoulder? Eventually up along the right side of your neck, and head, and face. Just nice soft strokes. Great. And then just bring your hand back down to resting on your abdomen. And then lower your left leg down. So your left leg is long and your right knee is bent. Still standing through your right foot. And let your hands rest at your sides. Good. And then begin to go back to that first early movement that we did, pressing through the right foot, connecting into the right side of the pelvis. Letting the pelvis lift a little bit and tilt a little bit to the left. And just kind of let your whole body roll left a little bit. Let your left leg roll out. But the one constraint is to keep your knee pointed relatively towards the ceiling. This is a wonderful thing that happens in our hip and our pelvis. Many of you have heard people talk about SI joints. This is going to be really freeing in the pelvis for this. And notice how you're breathing with this. Do you have a rhythm of your breathing? Do you hold your breath? Is your jaw soft? And then switch legs again. So this time the right leg will be long and the left leg, bend the knee. And again, for some people that might not be comfortable, so it's okay to keep both knees bent if you need to for comfort. But if you're able to lengthen the right leg, then again, start the exploration gradually. Pressing through the left foot, feeling that connection into the left side of the pelvis. Letting that gentle pressure through the left foot lift the pelvis so that it tilts to the right. Feeling that rightward turning of everything except the left knee. Letting the right leg roll out. You might even feel your right arm rolling out a little bit. You can let your head roll. Feel how the weight shifts behind your right shoulder blade, behind the right side of your pelvis, across the back of your head. Good. And then just rest. So these lessons are interesting because most of them are done lying down, although there are many sitting and standing lessons. We'll probably stick with lying down lessons during our 6 weeks together, but it depends on how you inspire me. But it's different because it's your lesson. Each of you have slightly different interpretation. Sometimes you kind of want to peek at your neighbor to see if he or she is doing the same thing or if you're doing it right. If you're way off base, I'll come and let you know. But how your whole nervous system interprets the lesson is also different for you. So what one person is experiencing in connecting the foot bone to the leg bone to the hip bone, it might be a very different sensory experience for somebody else. Okay, so bend just your right knee and place your right hand on your abdomen. And begin both sliding your right hand up your sternum and towards your left shoulder. And see if you can notice at what point might you want to press through your right foot just to help that right hand reach towards the shoulder a little better. So we're kind of combining those two movements. The right hand comes up the chest towards the left shoulder. And you might even see if you can begin to touch the floor behind the right shoulder. So just sort of reaching in that general direction and letting the pressing through the right foot, the lifting and tilting of the right side of the pelvis, just letting that help you. So that the arm starts to become a bit of an extension of the pressing through the right foot. How does that motion through your leg and pelvis actually help your right arm get a little longer? Maybe it can reach further beyond the left shoulder. And then coming back again. And then switch sides. So again, start with a small movement. Start with just orienting yourself to that relationship of the left hand sliding up the sternum. At a certain point, you'll invite the left foot to press into the floor and lift the left side of the pelvis as you reach towards the right shoulder, softly and effortlessly. Like it's all just what you do every day. You just lie down every once in a while and you press through your foot and you soften your trunk. You let your left arm reach towards your right shoulder, a little bit past it. How light and easy can you make this while still just seeing, what gets in your way? If you wanted to reach another 2 inches without efforting, without straining, but what stops you? Where in your body, if you had to make an effort, would you be efforting? And I don't want you to do it. I just want you to see if you can feel what would you be pushing through or straining through. Notice if you're letting your head turn to the right. And just see if that feels natural to let your head turn to the right with the movement. When you finish this next movement, just go ahead and take a rest. And just check in with your 5 lines. See how they're doing. What's changing? Maybe nothing's changing in the lines, but just how you're letting yourself be supported by the floor. How your shoulders are resting. How you sense your low back. The weight of each of your legs. And then please bend your right knee again. And place your left arm on the floor, but sort of up over your head or at a diagonal. And if you're not able to do that, if you don't have the shoulder range of motion, you can just go straight out to the side or not do it at all. But just at some sort of position so it's resting on the floor as high as you can comfortably. Yeah. And relax, so it's not a strain or a stretch for your shoulder. Good. And now place your right hand on your abdomen. And continue the movement, sliding your right hand up through the middle of you, across your sternum, over the left side of your chest and shoulder, and begin pressing through your foot. Feel just when's that right timing to press through your foot and begin reaching up your left arm. Or just softly stroking your left arm with your right hand. And maybe even beginning, if it's comfortable, to as if you're going to look up towards your left hand. Can you feel that movement in your neck and your spine? Really listening, making sure it's okay with the rest of the body. Going up and coming down. Pressing through the foot and just lengthening that right arm and hand out the left arm as far as is possible, but easy, effortless, pleasant. And just feel the timing of that. Notice what you're doing with your breathing. Your jaw. Can you easily slide your tongue loosely back and forth in your mouth? And then when you're ready, go ahead and switch sides. So the left knee will be bent and the right knee long. The right arm resting on the floor, out to the side, but up as high as you can comfortably for your shoulder. And then beginning to explore with your left hand through the center of yourself, across the right side of your upper chest, your shoulder, and pressing through your left foot. Letting your head roll, and maybe even to tilt a little bit to look up towards your hand. And then just pause in the middle. And bend both knees up. And let's start with your left arm on the floor, out to the side, a little bit overhead. And we're going to switch gently and softly from side to side. So taking the right hand up through the middle of yourself, pressing through the right foot, reaching out the left arm, tilting and turning your head to look towards the left hand. And then as you come down, you're going to bring your left hand down and bring your right arm up onto the floor. And then you're going to switch and bring the left hand up, press through the left foot, and reach out the right arm. So you'll do one side all the way through, and then just find a way to softly switch and go to the other side. It's a little easier if you keep both your knees bent so you can press through the foot. So you're pressing through the left foot as the left arm reaches out the right arm. And you're pressing through the right foot when the right hand is doing the stroking and reaching out the left arm. And breathing and keeping your jaw soft. And maybe a little smile on your face. And let your arms down and let your legs down. Take a full rest. See how your body's connecting with the floor, where you feel support and pressure. And sense into each of those lines. The line of your spine, from the base of your head, to the top of your sacrum, all the curves in it. Sense the line of the right arm, the tip of the shoulder to the tip of the fingers. And the left arm. and the right leg, and the left leg. And now I'm going to ask you to really take your time to roll to your side, to come up to standing. We're going to take a few moments in standing, just really sensing into yourself. What do you feel that's new or different or unusual? And then I'm going to ask you just to spend some time walking around the room, still just in the lesson, feeling into yourselves. And then we might have a few of you just share any, one or two or three words of any sensations that you're experiencing.